Everyone, thanks so much for joining us for this Wednesday's COVID-19 press briefing. We thank you so much for being with us. Today, Mayor Demings will discuss hospitalizations, our COVID cases, of course, including the number of deaths, which continues to climb. There is some new data on wastewater and gene copies per liter. The mayor will bring us up to speed on that. In this conversation, the mayor will also discuss testing, including by our friends over at the City of Orlando, and much more. Of course, the mayor will discuss the importance of vaccinations, where you can find them. Director Alvina Chu from the Florida Department of Health in Orange County is here and will report on important COVID-19 trending in the state and here in Orange County. We begin with Mayor Demings. Mayor.
Thank you, Dr. Williamson, and good afternoon to all of you as well. I welcome you to the 170th coronavirus update that we have provided for you from Orange County government. Who would have thought? We're basically into nearly the third year of this. We continue to hold these briefings, however, to make certain that our community continues to be well informed as we adjust to the virus. Today I have a number of people who are here. We have Dr. Yolanda Martinez, the Director of Orange County Health Services, should there be any specific questions about health services. We also have Commissioner Myra Uribe has joined us as well, and if there are any questions for our Spanish-speaking media, we have Ms. Yesenia Negron, who will do the translation for us, and we also have Commissioner Maribel Gomez Cordero, who has joined us, and we have Mr. Scott Howard from the Orange County Public Schools who has joined us here today. And so with that, I'm going to get into the status of where we are here within our county. First, let me just say, we all see what's happening, that the virus has been spreading rapidly throughout America, certainly throughout our community. And I have to say, our healthcare workers once again have been stretched to their limits. And we appreciate the efforts of our healthcare workers from Orange County. And I hope all of our residents appreciate what they have been doing to care for those who are sick within our community. The Florida Hospital Association reports this latest Omicron surge is once again straining hospitals with an increase of patients during one of the worst staffing shortages in decades. Today, there are over 11,000 Floridians hospitalized with COVID-19, according to the Florida Hospital Association COVID reports. And that same report indicates that some 235 of those patients are pediatric patients. While the Omicron variant isn't as deadly as the Delta variant, it is certainly highly contagious. In consultation with our hospital partners earlier today, they are all seeing an increase in their patients. Advent Health reported a significant increase in their patients. They indicated that 10% of their patients who are COVID positive are on ventilators. We also spoke with Orlando Health. They too stated that they have a significant number of COVID positive patients. And we spoke with Noir's Children's Hospital. They indicated that today they have the highest number of pediatric COVID patients since the pandemic began. Infectious Disease Director, Ms. Alvina Chu, is here from the Florida Department of Health in Orange County, and she will certainly share more with you about the numbers. Here in Orange County, we have experienced multiple weeks in a row of record-setting results of the number of COVID-19 gene copies per liter in our wastewater system. Of course, we're doing the wastewater monitoring, and Ms. Sarah Lux is here from Orange County Utilities, should we have questions specifically about what we're seeing in our wastewater system. When we look at the numbers, there's good news in the midst of bad news. And the good news is that we are seeing a slight decline in the gene copies per liter, even though the numbers are still very high. The Northwest Reclamation Facility was at 18.7 million liters last week, gene copies per liter last week, but it has dropped to 10.2 million. The Eastern facility was at 15.7 million, but has dropped to 5.5 million. And our Southwest facility was at 11.5 million, but the latest reading shows it dropped to 3.5 million. So in the midst of that bad news, there's some good news that it's going down. Numbers can rise and fall, certainly, as this natural cycle of contamination continues, especially with the holidays behind us. However, the people are recovering from COVID, contracted perhaps during many of those social gatherings. So while this is a promising sign, the next few weeks of data will be critical to determining if this is a new downward trend or not. Here are the latest numbers reported by the Florida Department of Health in Orange County. There are now over 319,000 coronavirus cases reported in Orange County alone since the start of the pandemic. The number of Orange County residents who have passed away of COVID-19 went up by 26 since we last reported to you to 2,325. So it still is clearly a deadly virus. Our 14-day positivity rate has jumped to 40.79%. I know Ms. Shue would get into that. That means that 4 out of 10 people in our community are testing positive. We have thousands of tests that are being done here within this county, and that's a staggering number. There's more than 10 of us in this room today, and what that's suggesting that if all 10 of us got, or 10 got tested, 4 would test positive. So keep wearing your mask and socially distancing. We want to thank the City of Orlando for opening a drive-through testing site at Camping World Stadium that acted much like a pressure release valve for what we were dealing with at Barnett Park and some of our other sites. So far, they have been administering some 6,500 tests a day. It has certainly helped to cut down on the wait times at our 3 Orange County testing sites by about 10%. We're still seeing a demand for testing very high here within our community. The other 2 testing sites are the Econ Soccer Complex and the South Orlando Youth Complex. I will tell you that even today we opened a testing site specific for our employees and their families, because as a governmental entity, our firefighters, our correction staff, and others really have to still come to work and serve the community, to protect this community. And because of that, we have seen a significant number of our employees test positive, albeit we are beginning to see the numbers decline slightly. But in either case, to make certain that when we send our employees out to serve the community, that they're COVID-free, we are providing an opportunity for them to be tested where they don't have to wait in these long lines, and their immediate families. And we next week likely will extend that somewhat to some of the other constitutional offices, and also work with the courts, because we have seen a significant spike even amongst those who work within the courthouse associated with different employers there. So that's the news related to the testing sites. If you want information, you can go to ocfl.net/testing. When we look at the testing sites, Barnett Park remains the only Orange County run site for vaccinations. Anyone 18 or older can get the vaccine between the hours of 9 a.m. and 4 p.m. 7 days a week. On the weekends, children can receive the Pfizer vaccine if available. Appointments are recommended for children between the ages of 5 to 11 years old, and remember that a legal guardian must be present. If you can't get to Barnett Park, there are many other locations for eligible individuals to receive a COVID-19 vaccine in Orange County. Vaccines are administered at various Orange County public schools. Perhaps Mr. Howard will talk about that. In addition, at federal retail pharmacies, at the VA Orlando Health Care Clinic, and various other community sites are offering the opportunity for vaccines. You can get information about these sites from ocfl.net/vaccines or go to vaccines.gov. The mask mandate remains in effect for Orange County employees. Our goal is to keep our employees, again, free from COVID-19. Right now, we have 289 of our employees that are out due to COVID. We're fortunate that none of them have been hospitalized. That is a drop from Friday last week, in which we had 327 of our employees who tested positive. With those updates, I'm going to turn it over to Ms. Shue at this time to give you further information from the Department of Health.
Thank you, Mr. Mayor. So as Mayor Demings had previously mentioned, we've had a total of 319,144 total positive cases reported to us as of today. Our 14-day rolling percent positivity average is 40.79%. And at the last news conference, the last time we spoke, the 14-day average was 30.27%, so an increase of over 10%. The 7-day average incidence rate, so the average of new cases that occurs per 100,000 population. The last time we spoke, it was 1,823.1, and as of this week, it is 2,226.5. So as I'll remind us that the CDC level of transmission right now is classified as high, and to reach that threshold, it's greater than 100 cases per 100,000 population and greater than 10% positivity. So I'll let you all do the math on that one. Unfortunately, we've had 26 additional COVID-19 related deaths reported to us since our last press conference on January 4th. Unfortunately, that brings our total to 2,325. And we want to express our condolences to the families and friends. For the past 2 weeks, the newest cases have been predominantly in the 25 to 44 age group. Yesterday, that group represented 25% of all new cases. For a vaccination update, we currently, though, for those who are 5 years of age and up, so Orange County residents who are eligible to receive any vaccine, those with at least one dose of vaccine is 73%. For 65 and up, we're encouraged to see that those with at least one dose of vaccine is 89%. Since the second week of December in 2021, the majority of the daily vaccine doses administered have been third doses or boosters, and the next largest category is first doses, and that's encouraging news for us. This highlights the fact that people are getting their booster shots for additional protection and that others are now getting vaccinated against the COVID-19 virus, thus creating greater community protection here. And finally, whether you've already received your COVID-19 vaccination or not, we want to encourage you to follow pandemic precautions, especially if you're at high risk for developing severe complications, and also if you have loved ones at home who are at high risk. And just to remind us about the good pandemic precautions, is to practice good hand hygiene by properly and frequently washing our hands with soap and water, making it a habit of cleaning and disinfecting commonly used surfaces, and wearing our mask and watching our distance or physical distancing. And lastly, and possibly most importantly, if you are sick, please stay at home. This is an opportunity for us to get better and also limit the possibility of transmitting the virus. And with that, I'll take any questions and turn it back to Mayor Demings.
All right, we'll open it up for questions at this time. There will be a microphone moving around. Steve, who that?
This is for Alvina Chu. Alvina, what do you make of the deaths? Because up to this point, we have said Omicron wasn't as ferocious, perhaps, as previous variants. So, do you expect that we will continue to have rising deaths? And anything else you can offer about that?
So we haven't seen yet that Omicron produces a more severe illness. The deaths will continue to increase, as will the hospitalizations, just because of the increase of the sheer numbers of people who are getting infected. And so the increase in pediatric hospitalizations and hospitalizations in general due to COVID that we've seen is basically, it's a volume of cases that we're seeing reflected. You know, for example, if we go back to, say, when cases were really low, and just for example, in May, if we had 50 cases reported and 10% of those were, say, pediatric, and then 10% of those get hospitalized, that's a half a person, versus, say, now, if we had 5,000 cases reported yesterday, you know, if 10% of those are pediatric, then it's 500 persons, and if 10% of those are hospitalized, it's 50. And so it's a 100-fold difference, but the proportion remains the same. So we will, unfortunately, do expect to see a continued increase in hospitalizations and deaths for this time period while the cases are increasing.
This is for Alvina as well. Angela Jacobs, WFTV. You mentioned the majority of new cases coming from the 25 to 44 age group. What about hospital admissions? What age group is that majority?
So I don't have those specific data. As far as trends go, the hospitalizations are increased, but the trends for ICU and severe outcomes is not increased. So those who are put on vents.
This is Treasure Roberts with WKMG News 6. My question is for Mayor Demings. It's my understanding that you all are waiting for about 100,000 tests from the state. I want to know when you all requested them and why do you think it's taking so long to get them?
We requested the 100,000 or so at-home test kits several weeks ago now. We can get you the precise date, but it was several weeks ago now, and it does not appear that we're going to receive them. So I don't know. It's still in the question mark category at this point. In fact, through our emergency management division, we requested a total of 500,000 at-home test kits that will cover the entire county with some of our community partners, you know, including the schools and others, and it does not appear that we will receive it from the state at this point. We remain optimistic. If not, we're going to continue to deal with the testing as we have now for quite some time. Fortunately, we do have, you know, the funds, the federal dollars to be able to assist us in doing this. We certainly will not be able to do it indefinitely, which is why we want to see those numbers eventually come down so we would not have to manage and operate so many testing sites. But at 40% of the people testing positive, it really it speaks to the human experience to me. Some people say, well, why are you doing the testing? If you are one of those people who feel or believe that you've been exposed, until you know your status, you can't have any internal peace as a result of that. So until you go and get tested, you don't want to inadvertently give it to a family member, a loved one, or anyone else, a coworker. So this phenomenon that we're seeing across the state of Florida and certainly across America is not unique to Orange County, that so many people are desirous of getting tested. I wish there was the same appetite for getting vaccinated, where we had long lines of people waiting to get vaccinated. But so we're still here having these press briefings to encourage people to get vaccinated. And I believe that part of the reason why we don't see the numbers of hospitalizations and deaths and otherwise as significant as perhaps what they could be is because people are vaccinated and they therefore have a milder form of a COVID experience. So we're going to continue to be responsive to our community and provide the testing. If we were not doing the testing, I just think that we would be at a crisis level where people would have a lot of anxiety associated with that. So we're trying to make certain that we help manage the human experience for our residents here in Orange County.
Lauren Cervantes from WKMG News 6. I have a question for the health department. I'm not sure if it would be you or best answered by Kent. But we've seen a high demand for testing in the community, long wait times, long lines. Now, I interviewed a woman who took a more creative approach to helping her community. She's a registered nurse. We've verified that. And she has a CLIA waiver. But she is performing COVID testing from her driveway off of Lake Underhill Road in the Waterford Lakes community. Is the health department aware of her operation, and do you recommend it?
I heard about it through the news, perhaps your article, but I don't have any comment about that. The tests or the CLIA licenses are regulated by the state DOH.
Do you have a recommendation, at least for advice for people as they see pop-up COVID testing sites, what they should do or questions they should ask to make sure they're legitimate?
So in general, so for persons who are going to get, say, like a COVID home test or buy a test kit from the drugstore, it would be to follow the instructions that are on the test and use the test as appropriate and as listed in the instructions, because the instructions are what gives it the authorization to give you a valid test. And of course, if you're sick, it's to consult with a healthcare provider. And fairly certain, I haven't taken a home test myself, but I'm fairly certain in the instructions is, especially if you have a positive or if you have concerns about your health, is to consult with a healthcare provider.
This is Kelsey Thord with West 2 News. I'm not sure which one of you may have the answer to this, so feel free to jump in either one. But I know you said, Mayor Demings, that you've talked to the Children's Hospital and they've seen a dramatic increase in hospitalizations in pediatric cases. Do we know what age those are? Are those under 5 where they can't get vaccinated? Are they teenagers? Any more information on those pediatric hospitalizations?
When we received the absolute number from the Morris Children's Hospital earlier today, I asked them that precise question, and at that time they were not able to break it out according to the age groups, but what they said to us, they would do a bit of research and follow up with us. And to my knowledge, we haven't received the response yet, but perhaps Ms. Hsu might know more specifically.
We don't have the specific breakdown of the age groups, but you would ask about, so when we talk about pediatric hospitalizations, we talk about less than 18 years of age.
Nika Hope from West 2 News. This might be best for Mr. Howitt from the schools. With the Biden administration's offer to send out millions of tests to schools, can parents now expect to get tests sent home with their children, or what are you expecting with that offer?
We certainly hope so. We think that the availability of home test kits, especially for those that are symptomatic, to verify whether they have it, is important. So we welcome the additional kits. We heard today we're going to get 10,000 additional kits at some time from the state, from the Florida Department of Health. So there's no ETA on those, but we look forward to those. We have 10,000 right now that are being redeployed because the expiration date has been extended. We held on to those to wait for the expiration date to be extended, and so we're going to deploy those as well. So whatever we can do to help inform parents as to the status of their children, or even our employees, we want to make sure that we have that available for them. So we welcome anything that the President would send our way. Thank you.
Okay, it appears that that was the final question. Well, we have one more.
Hey, this question is for Alvina Chu, coming from Nick with WFTV. He's asking, are there any signs Central Florida is approaching the peak of the Omicron wave?
So I don't have any strong confidence in my own internal crystal ball, but we do track the data, which what And lately, in the last week or so, we have seen a decrease in the increases in cases. So currently, cases are still increasing, but the proportion of those increases has gotten smaller.
All right. Well, thank you all for joining us today. At some point next week, we will likely do another update.